The combination of specific symptoms or signs of this mental illness is called schizophrenia syndrome. There are three syndromes of schizophrenia: positive, negative, and cognitive. The first group of syndromes is the hallucinatory syndrome. Perceptions and sensations that are responses to stimuli that do not exist in reality are called hallucinations in medicine. Hallucinations are divided into several subtypes related to receptors: hearing, vision, smell, taste, and touch. Signs of hallucinations include conversations with invisible interlocutors, reactions to phenomena that do not exist, such as suddenly listening and laughing without a clear reason. There can also be a lack of concentration on conversation or tasks. The patient might see things that are not real for others. Delusional syndrome involves beliefs in the existence of unreal phenomena and events. Conclusions based on fantasies are called delusional ideas. Such ideas are not subject to logical explanation. Delusions are one of the most noticeable and widespread manifestations of the illness, occurring in 80% of all cases, and are considered an acute phase. The content of delusional ideas often involves fantasies about relationships, persecution, and interactions. Disrupted thinking and speech involve the process of thought failures where thoughts are cut off. This is most likely associated with a pathology in thinking and memory impairment. It is expressed in the inability of the patient to maintain a coherent conversation, often forgetting how they began. Their speech is fragmented with a misunderstanding of the purpose of objects and phenomena, and a tendency towards abstraction and symbolism. Depersonalization syndrome. The boundaries between the self and the external world blur for a schizophrenic. They may perceive their own thoughts as not their own, and the surrounding reality as unreal. Sometimes they believe that relatives are strangers or, conversely, treat strangers as close ones. A common phenomenon is depersonalization, where a person believes they have transformed into another personality, have merged with the external world, or have completely lost their identity. Derealization syndrome. This syndrome is manifested by changes in the perception of qualitative characteristics. The world appears in different colors, formats, and sounds, seeming like an alternative reality. Second group of syndromes. Doctors distinguish two types of negative symptoms: primary due to the illness and secondary due to treatment or positive symptoms. Negative symptoms include several factors: loss of motivation and energy, limitation of physical activity, decreased intellectual ability and speech activity, loss of interests, minimal emotional response to external factors. In such cases, the schizophrenic shows extreme passivity, speaks in monosyllabic sentences, and responds to questions with significant delay. Negative manifestations of schizophrenia: physical and speech passivity, lack of will and spontaneity, autistic factors, limited circle of interests and friends, antisocial behavior, insufficient expressiveness in facial expressions and vocal tone, motor inactivity, use of a limited vocabulary, inability to make non-stereotypical decisions, lack of social interaction. Most schizophrenics exhibit a problem with minimal ability to concentrate. They lose the ability to process non-standard information, their willpower and life motivation significantly decrease. This leads to an inability to work, study, or even take care of basic personal needs. Thank you for watching this video. Please click like and subscribe to our channel for more medical videos.